just say you're well past your teen years. You wake up, you look in the mirror, and you notice it. It couldn't be a zit forming on your face. Perhaps you have had a few of them. You may have thought you would be finished with acne once you got through your teen years, but the fact is millions of adults still struggle with pimples.
Good morning.
Narva Norfleet didn't have acne as a teenager, but in her mid-30s, she started to break out.
I woke up and I had these big boulder, like huge bumps. I would go to the grocery store and do this. I never would look direct in your face because it's embarrassing.
About 10 to 15% of adults develop acne at age 30 or older.
Acne does not discriminate. We see it in men and women. We see it in dark and light.
Often the cause is something we've inherited.
More often than not, it's just genetics. And I often say, talk to your mom, talk to your dad, see if somebody in the family didn't start breaking out when you were a little bit older.
For women, another factor might be a change in hormones around menopause. Moving to another geographic location can affect some men and women, but doctors aren't sure why.
Most people with adult acne, we can get clear with topical medications.
These help with inflammation and help kill bacteria. But some people, like Narva, also need to take oral medications. One that worked for her, but should not be used if you want to start a family.
It used to be called Accutane, and it is a vitamin A derivative that often will give people the closest thing we have to a cure.
Narva's acne is virtually gone, and she says she feels great again.
It gave me so much confidence.
With her head down, she didn't want it.
And experts say many people think acne is a direct result of poor hygiene. In some cases, that may very well be the case, but it's certainly not the norm. So if you're one of the many adults who has acne, there's no need to be embarrassed. The truth is you can do something about it, just like Narva. And joining us today to tell us more is dermatologist Dr. Louette Sims. Thanks for joining us this afternoon.
Thank you.
So I guess it's not just wrinkles we need to worry about as we get older. Adult acne is very common.
Well, it is, and I especially see it in women more than men. And I think it's probably more of a problem than it used to be.
We're not talking about, you know, just a pimple here and there. That's kind of common, isn't it?
That's very common. I tell everybody that they can get acne at any time in their life, and I see it in babies, I see it in old people. But if you're having persistent breakouts, that's when usually it's really a problem for people.
And are we talking about acne just on the face, or are there other parts of the body you can get it?
Well, the face is the most common place, but acne can affect the chest and the back especially.
They're talking about menopause, and sometimes women who've never had acne before all of a sudden get it during menopause. Why is that?
Well, we've always known that hormones are a big influence of acne, and that's one of the reasons that teenagers start to get acne, because certain hormones are kicking in. And lots of times it's sort of fluctuating hormones that tend to cause acne, and so, for instance, a lot of women will just find that before their period comes on, they start to break out. And around menopause, hormone levels are fluctuating.
Right.
And that can be a trigger for the acne.
What else can trigger it?
Well, there are a lot of influences on acne. So I personally think that stress can be a big aggravator of acne or a trigger of acne. Like the clip said, genetics plays a big role. So, you know, there's a lot of stressed out people. They don't all break out with acne. But stress actually affects hormones, and that's probably the link with acne.
Medications?
Yeah, there's certain medications that can trigger acne, especially steroid medications. Of course, those are hormones.
Right,
you know.
right.
Certain unusual medications can trigger acne. So mechanical things or external forces can trigger acne. That can be things like friction in the skin, occlusion of the skin, you know, tight clothing, sweat, things like that.
So if we get acne, you know, you get a pimple or something, I know me personally, I have the urge to just, like, I don't know, squeeze it.
You want to pop it.
You want to pop it. You want to scratch it off or something, but really you shouldn't.
You shouldn't. Yeah, that's a pretty common tendency, especially for women, to want to pop that pimple or pick the spot off. But I usually encourage people not to do that, because it actually makes the lesions last longer for the most part, because it traumatizes the skin. People just hate to see that little white head on there, you know. But it can increase, it can prolong healing. It can increase discoloration that people often get from acne, and it can sometimes cause scarring. So leave them alone.
So what do we need to do?
Well, you had mentioned before that hygiene is not usually the cause of acne, and I think it's hardly ever the cause of acne. Maybe in the 12-year-old who's not learned to wash their face regularly, but the common mistake a lot of people make is that they over wash their skin. So they go, oh my God, I got acne, I must not be washing well enough. They start to scrub, they use really hot water, they start to dry the skin out with alcohol and witch hazel and astringents. And all those things can actually really aggravate acne if you sort of already have a tendency for it. So I usually recommend very gentle cleansing. You know, get the sort of sensitive skin stuff. Don't use hot water, don't scrub. And then there are several over-the-counter medications to start with. We usually suggest products with salicylic acid and benzoyl peroxide. And you can get those in washes, wipes, creams, spot treatments, you know. So usually do a combination of the two. For instance, do a wash with one ingredient, with that ingredient. Do a leave-on product with the other ingredient, that sort of thing. And for a lot of people with pretty mild acne, that really will help a lot. You have to be consistent, you know, you have to treat regularly. If those medications really don't do the job, that's when it's time to see a doctor, and prescription medications can help.
What about birth control pills? I've heard those help.
Yeah, so if topical therapy is not really working well, we consider oral therapies. The two most common will be antibiotics and hormonal therapy. Obviously, the birth control pills are really only for women.
Yeah.
But because the hormonal fluctuations are a big trigger of acne in many women, birth control pills, which basically suppress the production of hormones, can really help to calm down acne.
What about diet? Should we watch what we eat?
Well, diet is one of those subjects that has been blamed needlessly, probably at times for acne, and over the years it changes. You know, everybody hears you should drink a gallon of water a day, don't eat your French fries and fatty foods. But there's been very little evidence in the past that certain types of diet changes help or worsen acne. However, there recently have been some studies that did show that there are a couple things that may be aggravators for acne in the right person. One of them, surprisingly enough, is skim milk.
Skim milk.
Yeah, so not whole milk, but skim milk. We don't know why, but and probably the person who has a cup of milk a day or half a cup on their cereal, it's not a big deal. But there are some people who drink, you know, a quart of milk a day, and if it's skim milk, it might be aggravating the acne. The other is a high glycemic diet. So there was actually an interesting study that showed that when you look at third world countries or really sort of almost like Aboriginal populations, they don't get acne.
Right.
And the Western diet or sort of
lots of sugar.
Industrial societies, lots of free sugars, and free sugars are not just sweet.
Right.
You know, white flour, pasta. You know, and then the obviously sweet things: cookies, cakes, colas, you know, or sodas. So they may actually trigger acne quite a bit.
All right, Dr. Lewitt-Sims, thank you so much. Lots of good information, of course. Always consult your doctor, and don't be embarrassed about it. And if you would like to read more about adult acne, go to delmarvalife.com and click on the show tab. So we know how to clear up our face. Now let's turn to our vision. Up next on Delmarva Life, the story of a man who wore glasses for years, but it just took one procedure to have him seen 20/20. We'll learn more about it. And you're going to want that clear vision to see your son or daughter all dolled up for the prom. We'll check in with the experts at About Faces and Salon to find out how easy it is to get a fabulous red carpet look for the special night. But first, we just learned about acne. Dr. Oz has more on how our diet may impact our complexion.
Hi, I'm Dr. Oz. Thinking of going gluten-free? Well, here's what you got to know. Chronic stomach problems, headaches and brain fog, acne and fatigue are signs you may have a sensitivity. See your doctor for an evaluation. If you're not sensitive, a gluten-free diet tends to be higher in fat and lower in fiber and nutrients.